Our heart tirelessly works for us throughout our lifetime, always at our service. It is a continuously working pump which generates pressure to push and distribute blood to all the tissues of the body through blood vessels. It receives deoxygenated blood for purification from the veins and pumps out oxygenated blood for tissue metabolism through the arteries. Thus, both arteries and veins play an important role in the flow of blood. The pumping action of the heart creates a definite pressure on the cardiac muscles, forming the heart wall, which causes the blood to flow through the arteries. This is called as blood pressure, popularly known as BP. Cardiac muscles forming the heart wall contract to push out the blood from its chamber to a great artery called aorta, while cardiac muscles relax to receive the blood from great veins called inferior and superior vena cava. This contraction and relaxation of heart chambers respectively gives rise to systolic and diastolic pressure within the wall. Systolic pressure indicates the pressure that the heart generates to pump blood to the rest of the body. Whereas diastolic pressure refers to the pressure in the blood vessels between heartbeats. Blood pressure is expressed in two separate figures. The first indicates systolic pressure and the second diastolic. It is known that systolic pressure increases as we grow old, while diastolic pressure begins to decline after 60 years. However, the force with which the heart pumps increases when there is an increased demand of blood supply to various tissues, like in the case of exercise, or when normal blood flow has to occur through narrowed vessels, as in the case of atherosclerosis. This gives rise to increased blood pressure or hypertension. Hyper means excess or over the normal limits. Hypertension can be temporary, only to meet a required demand, as in the case of exercise. It is a sign that the heart and arteries have to overwork. Significantly, it is persistent hypertension that leads to various health problems. Hypertension is one of the leading killer diseases in the world today. Hey, there is no reason to get alarmed. Much depends on us and on our positive initiatives. Our present discussion is about hypertension, its causes, signs, symptoms, complications and modes of management. First things first, let us know the criteria to term our blood pressure as hypertension. For an individual, systolic blood pressure measuring 140 millimeters of mercury or greater and diastolic blood pressure measuring 90 millimeters of mercury or greater can be referred to as hypertension. Higher level than this is alarming and should be paid immediate attention. Ignoring it increases the risk of various health complications. Blood pressure is measured with sphygmomanometer. Pressure cuff is applied to the arm, and the cuff pressure just above where the arterial pulsation at wrist disappears is slowly increased. This marks the time when artery is made to collapse temporarily by manual pressure. Then pressure is slowly released to listen to the typical sound produced with the help of a stethoscope. Appearance and disappearance of this sound helps to assess systolic and diastolic pressure. So we come to the next question. When and how do we test ourselves? Ideally, blood pressure readings should be taken at rest without having any stimulant like coffee or tea or smoking. A minimum of 2 readings should be recorded and averaged at 2 different occasions. If these readings are above specified value, then it is indicative of hypertension. You can be self-reliant and learn to take these readings at home, so that occasions of sudden increase in blood pressure can be timely recognized and immediate remedial actions taken. Many a times, hypertension is latent. You may not have any symptoms and it may go unnoticed for years. But watch out! Symptoms such as headaches, dizziness, fatigue, and ringing in the ears may be due to hypertension. Clinical examination of eyes, heart, and nervous system prove helpful to ascertain the involvement and evaluate the severity of organ damage caused in long-standing or malignant hypertension. Blood tests are conducted to check kidney and thyroid functioning. And an electrocardiogram or ECG reveals thickening of the heart muscles and irregular heart rhythms. Secondary hypertension needs identification of a treatable cause. Obesity, diabetes, smoking, stress and alcoholism are known to increase the risks of hypertension and the subsequent complications. Undiagnosed or incompletely treated hypertension can cause damage to many organs, including the blood vessels, brain, eyes, heart, and kidneys. This may give rise to the risk of having a heart attack, stroke, kidney failure, and blindness. Just go through the above factors again. Don't you agree that this life-threatening ailment is self-invited, self-afflicted? So, be vigilant, make positive changes. Based on cause and characteristics, hypertension is classified into various categories. Most common and idiopathic essential hypertension which is not preceded or occasioned by any other disease. Isolated systolic hypertension, especially in the elderly. Treatable secondary hypertension in young patients. Symptomatic and fluctuating labile hypertension, or in other words, unstable hypertension. Life-threatening malignant or harmful hypertension, which is marked by an unusually sudden rise in blood pressure to attain dangerous levels. Such a case indicates medical emergency and needs hospitalization. In 6 to 8% cases, hypertension occurs during pregnancy. It manifests as chronic, preeclampsia or gestational hypertension, which develops slowly. These facts are alarming, aren't they? Fortunately, there are simple preventive measures. Invest just 10 minutes in regular aerobic exercise. Is that asking for more? Limit your salt intake. It makes your food tasty, but not your life. Eat a diet rich in fruits and vegetables and low in saturated fats. Avoid smoking and alcohol. Maintain a desirable body weight. Learn to manage stress. Use stress-relieving techniques such as yoga, Meditation. Avoid decongestant or vasoconstrictor medicines. Regular checkup and monitoring of blood pressure with lifestyle modification would certainly help to prevent complications. It will also enhance the quality of your life. So now we come to a vital factor to be decided by the doctor. As such, a word of caution: self-medication and treatment are not advisable. Generally, lifestyle modification helps in gaining good control over hypertension. The anti-hypertensive medications used for such treatment include diuretics to flush out excess fluids and minerals through the kidneys, especially sodium through formation of excess urine, alpha or beta blockers to help relax arteries, decrease the force of the heartbeat and consequently reduce blood pressure, ACE inhibitors, a type of vasodilators to help reduce blood pressure by inhibiting the substances in the blood that causes blood vessels to constrict, angiotensin receptor blockers, which are useful in reducing complications related to high blood pressure, and calcium channel blockers to reduce blood pressure by inhibiting calcium flow and relaxing blood vessels. Usually, hypertension requires lifelong treatment with anti-hypertensive medication. It is necessary to remember that anti-hypertensive drugs should not be stopped without doctor's advice. Such misuse can cause a sudden rise in blood pressure, as in malignant hypertension. Active or vigorous intervention is required in hypertensive patients with diabetes, heart or kidney disease. These then are the facts about hypertension. Now that you're armed with them, do make use of them. Be proactive, seize the initiative and manage hypertension. Good luck.